But my first step is always heal the gut.
Hmm.
Always, always, always heal the gut first. And that's one of the basic tenets of Ayurvedic medicine, that when you have a strong gut, and I'm talking about the physical gut, when you have a strong, it's called Agni or digestive fire, you're able to start to burn up old toxins, both physical and emotional. So I always begin with that. And then as their digestion becomes stronger, then I start working on, like their daily routine. When are they eating their biggest meal? When are they going to sleep? Because once you get in sync with like your circadian rhythms, now you have your entire body is just trying to support your well-being. And that's like having a walking pharmacy working on your behalf like every second of the day. So that's always my approach, is like get back into your natural daily routine and heal the gut. And then the next steps, almost, they honestly start to happen spontaneously, and that's usually the point where I start to bring in like a meditation practice, using typically mantra meditation, as we talked about, when we talked about sound therapy. And then it becomes very spontaneous. And the thing is, for people who aren't ready to take the next step, that's okay. That's when they stop. And usually they'll come back to it in 1 or 2 years when they have the support in their life to take that step.
Now, for the gut healing that you mentioned, is that going to change depending on someone's dosha, or is there like kind of a similar protocol, so to speak, that you're going to use for most people?
Yeah, you're so intuitive. So it's both. It's very dosha specific, but then there's some core things that we tell all of our patients to do. Like there's certain foods that nobody's really going to tolerate on a regular basis. Things like caffeine or alcohol or processed foods. So for every patient, I always have them move towards more of a whole food diet, heavily plant-based. And that does not mean that they don't eat meat, but that the majority of their plate should be filled with vegetables. And we slowly work them up so that they're eating a naturally high dietary fiber, diet, but it's all according to their dosha. So what a high fiber diet might look for a pitta patient may be very different than a vata patient. And a vata patient would need to add in like more grains than a kapha patient. So there's those little kinds of tweaks.
I see. Okay. Okay. And then I guess comparing this to functional slash integrative slash naturopathic medicine, probiotics play a major role with gut health in the West. What's the role of probiotics with Ayurvedic medicine? Is there a role?
So, first of all, in Ayurvedic medicine, and Ayurveda was one of the inspirations for functional medicine, and many naturopathic schools include information about Ayurveda. So, Ayurveda has been an inspiration for a lot of natural traditions, just because it's been around for so long. But in Ayurvedic medicine, I always look at probiotics as like sending Girl Scouts into world war. Like you've got to prepare the environment for these probiotics to survive.
Hmm.
And so the first step is always reducing the inflammation, and making sure that your diet provides prebiotic fiber to, create a healthy home for these probiotics. And then I'm a big believer in, using natural probiotics. And so in Ayurvedic medicine, we typically recommend a drink called lassi, which is, it's just a spoonful of yogurt
Hmm.
in water with some digestive spices, and you drink that at lunchtime. And so I think it's really important for you to know that your probiotics are alive, and that's hard to do, sometimes when they've just been on a counter for X number of years.
Hmm.
So it's having a, literally a living relationship with your probiotics, but you have to first make sure that your gut will support their habitat.